beings go through a number of different physical changes throughout the course of their lives, beginning with infancy and ending with late adulthood. Physical development has to do with the way that the human body develops or matures over a lifespan, and includes how humans view the world as they experience physical changes through the stages. Some elements of physical development include size, weight, gender, hormonal changes, and aging. For better understanding, here are the 7 stages of a person's physical development.
Physical growth occurs rapidly during the first 2 years of life. The transition from infancy to toddlerhood is marked by the infant switch from crawling to walking. The maturation process happens in an orderly manner. That is, certain skills and abilities are developed before other abilities are reached. However, it is also very important to realize that the rate at which these milestones are reached can also vary.
During the first 2 years, the body grows more rapidly than at any time after birth. Gross motor development refers to control over actions that help an infant move around, such as crawling, standing, and walking. Body fat, which helps the infant maintain a constant body temperature, increases after birth and peaks around 9 months of age.
Ages 2 to 6 are the early childhood years or preschool years, and this is the second stage of the physical development of an individual. Although physical development in preschoolers is dramatic, the development is slower and more stable than during infancy. And the biological, psychological, and social changes occurring at this stage are integrated and interrelated.
Even at this early stage of life, boys tend to have more muscle mass than girls. There are 2 kinds of motor skills in this stage. Gross motor skills involve large bodily movements such as running and jumping, while fine motor skills use small bodily movements like writing and drawing.
Ages 6 to 11 comprises of middle childhood. Like infants, toddlers, and preschoolers, these older children continue to grow physically and cognitively, however, slower compared to early childhood.
By beginning of middle childhood, children typically have acquired a leaner, more athletic appearance. Girls and boys grow about 2 to 3 inches and gain about 7 pounds per year until puberty. The typical minor illnesses of early childhood are colds, coughs, and stomach aches. These are likely to lessen in frequency in middle childhood.
Adolescence. The transition period between childhood and adulthood encompasses ages 12 to 19. It is a time of tremendous change and discovery. During these years, physical, emotional, and intellectual growth occurs at the busiest speed, challenging teenagers to adjust to new bodies, social identity, and expanding worldviews.
At around ages 12 to 14, boys become taller, heavier, and stronger. Their voices deepen, their shoulders broaden, hair grows under the arms, on the face, around the genitals, and on other parts of the body. Girls grow taller, their hips widen, their breasts become rounder and larger, hair grows on the legs, under the arms, and around their genitals. At this time, females can become pregnant. Teenage boys may also experience the harmless release of semen during sleep, termed nocturnal emissions, or commonly known as wet dreams.
Adulthood is characterized with psychosocial gains and steady but slow physical decline. This stage is divided into 2 phases. The novice phase, which is the transition from adolescence to early adulthood, and the culminating phase, which is the journey towards adulthood.
Young adults experience excellent health, vigor, and physical functions. Their strength, coordination, sensation, and sexual response are at the maximum. They typically look and feel attractive and sexually appealing. Young men may have healthy skin, well-defined muscles, and their hair mostly developed, while young women may have soft and supple skin, a small waistline, toned legs, thighs, and buttocks.
Decades of exposure to work and stress take their toll on the body as wrinkles develop and organs do not function well. Other changes include decreases in strength, coordination, and heart and lung capacities decrease.
Middle adults experience presbyopia, or difficulty in reading or far-sightedness. Menopausal symptoms among women include hot flashes, headaches, irritability, and dizziness. Generally speaking, this is the stage when both men and women feel less sexually attractive and appealing. because they have gained extra weight, experienced loss of hair, and are feeling less energetic.
The late adulthood period is the years that encompass age 65 and beyond. It is considered as the period of decline as aging in late adulthood profoundly affects the physical appearance, sensation, person's reflexes, and his or her motor abilities.
At this stage, persons started to lose his or her lifestyle, such as poor diet and lack of exercise. Energy reserves dwindle. Their cells are decaying. Muscle mass decreases. Body systems and organs, such as the heart and lungs, become less efficient. Older adults' appearance changes as wrinkles appear and the skin becomes less elastic and thin. Hair thins and turns gray as melanin decreases, and eventually height lessens as bone density decreases. Senses begin to dull, like hearing diminishes, and as a result, elderly develop suspiciousness or paranoia. Yet, the sense of taste remains fairly intact. Their reflexes become slow, and fine motor abilities continue to decrease. Generally, older adults score lower overall on the manual dexterity than do younger adults.
Aside from the physical aspect, there are other factors that are needed in a person's total development, such as the emotional, cognitive, psychosexual, moral, and psychosocial development.
Although each aspect differs in types of development, they operate together and are affected by each other.
which means that there is an important relationship existing between them.
Therefore, all these aspects are essential for an individual to be fully developed.